It is that time of the year when everyone in the family is back in one place together. Well, with opportunities to laugh and, of course, to share memories, it's almost like you're reliving it again. But for some this year, maybe dedicated to adjusting to a new normal if they have someone with Alzheimer's. Joining me now is Jim Herlihy with the Alzheimer's Association. Thank you so much for being with us today, Jim. We really appreciate it.
Oh, it's my pleasure.
Yeah, thank you so much. Such an important topic. We know that Alzheimer's is typically a slow progression disease. Can you tell us a little bit about the early signs that people can be looking for?
One of the most common early signs of Alzheimer's is memory loss. And so you'll notice that your loved one doesn't remember all of the things that they used to do. It might be if it's your mother and she's trying to create favorite Christmas recipes, that she may forget the ingredients or forget how to use the kitchen implements. And so those are some early signs that you can look for. Others can be changes in personality. Sometimes it's that a person is not responding the way that you would expect them to. And it's for things like that we encourage people to either talk to their healthcare professional, their family doctor, or call our helpline, because we have people who are standing by. And this is the time of year when we get most of our calls, because you get families who are getting together after having not seen each other for a long time, and they notice differences in their loved one that they really can't explain.
Yeah.
It's not always Alzheimer's, but it can be.
Right. Jim, you know, the holiday time especially can be kind of crazy, right? You want to pack in so much with your loved ones and really get out and about and do some fun things. But for family members that don't want to overwhelm their person with Alzheimer's, what can they do? How can they respond?
Well, it's important to let family and friends know in advance that their loved one is living with Alzheimer's, because that does change how they respond in these situations. So giving people a heads up in advance that whether it's mom or dad or grandma or grandpa is not the same, that they're going through these changes, helps people understand that when they arrive, they can't expect things to be the way that they were. So maybe toning down the celebration a little bit, simplifying some of the family traditions, and also recognizing that at this time of year, it's getting darker earlier, and there is a symptom called sundowning when people with dementia get a little bit more confused. So it's better to keep things simple so that they don't have quite as much stimulus as they would.
Great ideas. Jim, and you touched on this briefly, but if family members notice that are concerned about their loved one maybe suffering from Alzheimer's, what's the first step that they can take?
Well, the first step is to talk to the family physician. They should get a diagnosis, because there are other things that can mimic the symptoms of Alzheimer's. It can be a vitamin deficiency. It can be a urinary tract infection. It can be Lyme disease. It can be the after effects of surgery or taking medications. So it's best to eliminate some of those other options and determine whether it really is Alzheimer's. And then the doctor can provide some direction in terms of what steps can be taken.
All right. Jim Herlihy with the Alzheimer's Association, thank you so much for being with us. And you can find more information, as always, on our website, cbscolorado.com. Jim?
Karen, very important topic.